Calum spent 2 days in intensive care after his operation, which they kept him ventilated for sort of 24 hours post-surgery, just because it had been such a big operation, to give his body a little bit of a chance to recover. Calum moved from the intensive care unit to the high dependency unit, which is actually up on the cardiac ward. There you move from one nurse to a patient to one nurse to two patients. So there's not such a high requirement for the one-to-one nursing, but obviously you're still very closely monitored, aren't you? Very quickly you begin to see lines and drains being removed, and your child becoming a bit more comfortable, because obviously the drains and things are quite uncomfortable.
If he laughs, it's really painful and that can make him cry, so he wants to recover and be happy. A therapist will come up and they'll support him, and they'll tell him to have a teddy bear or pillow and put that close to his chest, and that will ease the pain, and over time that gets better. We're really lucky that you can actually spend time beside them as they recover, so you can actually stay overnight and be by their side to watch that recovery. And it's amazing how quickly they bounce back, and it takes longer for the parents to get over the surgery than the children, I think, sometimes.
Yeah, having 3 children, it is quite a challenge in terms of feeling you're supporting everybody.
Yeah.
Intensive care is a hard environment to be in on your own, and I think you need support from each other, and to support Calum at his most vulnerable time. Once Calum has moved back up to the ward, one of us stays with Calum and then one of us comes home. So there's always one of us at home in the evening, and then to help with the morning routine, and just to keep on top of the homework and washing and those sorts of normal things that still need to go ahead. You can talk to parents in the parents' room who are also going through those same feelings, and that can really help. So there is always support there to help you. I think we're, as a family, we're very open, aren't we? We're very close family.
We don't hide anything from the children. We certainly don't hide anything from Calum. We explain to him, we're going to go for an echo, and that's going to lead to procedure maybe, and then we'll have to have surgery next year. So we're really open with Calum.
It's about that trust as well, because if we're not honest with them now, then they won't trust us. Going forward, focus on the good things as well. And Calum did amazing and has come through this operation. We all know he will need more surgery in the future, but actually let's enjoy life and make the most of the good times. I know he gets frustrated. He doesn't like feeling different, and he can see those differences more now he's a bit older.
So I tend not to dwell on what the future holds. When he has his surgery, I kind of think, great, we can get on with life for another 3 to 4 years maybe, and then we'll have to go through it all over again. But sadly, it's kind of come around quicker than we think. So,
I cope better than I used to. When he was younger, I think I was completely consumed by it, and I couldn't see beyond Calum's heart condition. I like to try and cope by making sure that everybody's well prepared. I think that's probably my strategy.
So it's an incredible experience and journey, and it's really shaped us as a family. It's a roller coaster of a ride, and you will be very resilient at the end of it.
We have some amazing people that do such an amazing job caring for him, that we know he is in the very best of hands. Totally. And we will take that next step as it comes, and we'll deal with the consequences of that as we go forward, won't we?